Thank you all very much. I now recognize myself for a series of questions. If you have had the chance to follow the initial workings of this subcommittee to date, you would know that the drive of this committee is to perform an after-action review, have lessons learned, create a path forward for any future pandemic so that we may be able to predict, prepare for, protect ourselves, and hopefully prevent any future pandemic. This, I believe, would be consistent with the suggestion made by Dr. Lowenthal. Hopefully, we may produce a product that will allow us to certainly be better next time out of this committee. It's a fair question why decisions may have been made. Were they based on data, hypothesis? Were there motives to the decisions, such as personal gain or political gain? All fair questions. Dr. Lowenthal recommended having a National Intelligence Officer for Health. In many ways, I believe we have this with the National Center for Medical Intelligence, but we may need to expand their role. It was also suggested that the intelligence community hire experts with backgrounds in medicine and epidemiology and other specialties. And I agree with that, and that's why I've been requesting from OD&I information concerning those experts that they have consulted during their review of the origins question. I'm interested in knowing which actual specialists weighed in for each component of the IC. If one agency has 20 virologists and another has none, that can make a huge difference in an analyst's outcomes. So I'm curious as to why so many agencies have different opinions on this. The expertise of those that have contributed to each agency matters and makes a difference. For this committee, I have stated that honesty is non-negotiable. That requires truth. And I understand that 100% certainty in an analysis is difficult to come by. But what can be truthful is the level of confidence in an analytic summary. Unfortunately, during my time on the Intelligence Committee, I've seen cases of what seems to be political partisanship. I've seen a situation where analysts came forward as whistleblowers, charging that their analyses were changed or ignored for political purposes. In other words, their analysis stated that things were going badly, and yet after going up the chain, a politician stated that everything was going well. Mr. Ratcliffe, as OD&I, did you ever feel that information was being withheld from you or altered in any way, or did you have that concern?
Mr. Chairman, I would say that fortunately that did not happen very often, but it did happen on occasion, and I didn't just feel it. As I referenced in my opening remarks, the analytic ombudsman referenced the fact that there were times when intelligence was suppressed.
So why and what kind of information was that, if you can share it?
Well, as it's already been publicly available, the ombudsman made specific reference to intelligence on China.
So did this, in your opinion, hamstring your ability to conduct your job?
I think it made it more difficult, but through persistence and some of the things that Mr. Feith talked about, we were able to, in looking at the intelligence, particularly as it related to COVID origins, to still get to a point where we could protect sources and methods, and yet make some of that intelligence available by declassifying it. And he referenced the process whereby we did that through a State Department fact sheet.
One of the aspects of this investigation that is most important is learning who the IC consulted with during the review. As I said, we want to know what kinds of experts each component worked with. I'm going to ask each of you, to each witness, do you think this question is an important one when it comes to origins of COVID?
I'll begin just by saying it is, because sometimes, in this case particularly, when we're talking about COVID-19, our analytic judgments are framed in part by science. And so who the scientists are and how they're motivated certainly is important.
Yes, sir, I'd agree, and just add the element that conflicts of interest in general and with respect to the enormous amount of scientific exchange with China are especially important, as China is central to our national security analytical work going forward.
Doctor?
I think it's fair to ask the Intelligence Committee who they consulted with, yes.
Thank you. Mr. Feith, you were heavily involved in this investigation from the side of the State Department. While you were gathering information, did you struggle to find experts that did not have conflicts of interest?
In short, yes, and that problem became clearer in retrospect also.
And do you believe these same conflicted scientists may be briefing the IC today?
I can't speculate about today, but based on the experience a few years ago, yes.
Thank you. Quickly to Director Ratcliffe and Dr. Lowenthal, in your opinion, is it acceptable or practical to avoid or ignore the truth from Congress if trying not to divulge or to shield a covert operation?
I don't think it's ever appropriate to ignore the truth. I think from the intelligence community standpoint, there's an ability to protect sources and methods, but still meet our obligations to keep members of Congress informed through its proper oversight role.
Doctor?
There is a provision of law that requires that Congress be fully and currently informed of all current and significant anticipated activities. I'm probably the only person in this room who was in the Senate chamber when the Senate Intelligence Committee was created, so I am an advocate for congressional oversight, Mr. Chairman.
Yeah, I have read that statute myself, but I've had to bring it up and still get fought a few times in the Intelligence Committee. So the next question for the two of you, is it important for the IC to try to know all they can about the weapons systems of our adversaries, including biological weapons?
Absolutely, and in the case of China, the intelligence community has publicly addressed China as our top national security threat from a nation-state perspective. So particularly, that's important with respect to the country of China.
Mr. Chairman, yes, this has always been a high priority for U.S. intelligence since the committee was created in 1947.
Thank you. Should a virus that killed more than 1 million Americans be an intelligence priority for the IC and specifically the CIA and DIA?
Absolutely.
Doctor?
That depends on the policymakers. We don't make our priorities. The President, the National Security Council determine the priorities for the intelligence community. So if they determine it's a priority, then yes, it is. If they decide there are higher priorities, then no, it isn't. But this is not a call for the intelligence community. This is something that's not understood. We don't set our priorities. We are there to respond to the policymakers. I helped create the current priority system, and it's one where we derive from the President and his National Security Council where are the areas you want the most emphasis, knowing that inevitably there are going to be areas where we spend less attention because we have finite resources.
Well, that's a fair assessment. I would have to say as a policymaker that I think it should be a very high intelligence priority. That well taken. Finally, Director Ratcliffe, we sent a request letter to Director Haynes on February 13. To date, we have yet to receive any documents from ODNI. Understanding all the appropriate restrictions on classified material, as a former director, do you believe it's important for ODNI to fully cooperate with our investigation and produce the requested documents?
Yes.
I would now like to yield to Ranking Member Ruiz